Hello, great people. Welcome to another interesting, empowering episode of Focus on Health. For the next 3 episodes, we'll be talking about cancer. And right now, we'll be talking about cervical cancer with an expert, a surgeon and a medical advisor at Bliss Medical Center, Dr. Macharia, to just give us an impact and also just try to explain to us what it is all about. But right now, I'm going to leave you with the Healthy You segment. See you on the other side.
Five foods for a healthy cervix. 1. Winter squash. Squash is abundant in beta-carotene, an antioxidant that becomes vitamin A in the body. It makes the immune system strong and may lower the risk of cancer. 2. Pink grapefruit. The key compound for cervical health here is lycopene. It belongs to the same carotenoid family as beta-carotene. Lycopene in supplement form has often been used as a treatment option for people who have an HPV infection. 3. Broccoli. The B vitamin known as folate is commonly prescribed to women to ensure the health of their reproductive system during childbearing age. 4. Bell peppers. Anyone who's ever popped a vitamin C tablet to fight off a cold knows this antioxidant is strong at curing infections, and that same could be true for HPV infections, and the faster those can be cleared out, the better. 5. Spinach. Like vitamin C, vitamin E also has antioxidant properties thought to keep the body strong and healthy.
Welcome back. You're still watching Focus on Health. We're with Dr. Macharia, a surgeon and a medical advisor at Bliss Center. Thank you very much, Dr. for joining us today.
Thank you, sir.
Yeah, so when somebody says Dr. Macharia, who really is Dr. Macharia?
Dr. Macharia is a medical advisor with Bliss Medical Center.
Yes.
And basically is a person who's been in the medical field for the last 20 years and who has a lot of interest in cancer, especially prevention of cancer in our society that has become a menace.
Yeah, of course. When we talk about your interest and also your spanning, your experience spanning over 20 years, that's the reason why we came here. And today we really want to know more about cervical cancer. So, and it's really a menace right now. What are the statistics? Are they really something that we should be concerned about as a nation?
Yes, definitely. Cervical cancer, what some people call it cervical, the cervical cancer is one and the same thing, is #1 cancer in this country. And the reason why it's of interest is that when detected early is 100% curable. So this is a cancer that we can eradicate in our society. Yeah, and by either preventing through screening, although we'll come to that, or vaccination early enough, but we'll dwell on that later.
And of course, so basically now, what is cervical cancer? Of course, somebody may think that cervical cancer, it affects the cervix, but breaking it down to what somebody can be able to understand.
Okay, to a layman, because this program is meant for the layman, to everybody to be able to understand. So the cervix is the mouth of the womb. The womb is where the baby sits when a lady is pregnant or even not pregnant, is the opening of the womb. So cervical cancer is cancer affecting the mouth of the womb in simple terms. Yes.
And that we've talked about that. What are the symptoms or what are the risk factors for cervical cancer?
#1 is that we'll start with the risk factors, then we can go to the symptoms, because those are two different things. The risk factors is cervical cancer is associated with a certain type of virus called human papilloma virus.
The HPV virus.
The HPV virus. Yes. That is the commonest cause. It's associated with that. There is also an aspect of genetic, but the strongest indication, the strongest from research, the human papilloma virus is a victim in cancer of the cervix. It causes genetic change to the cells of the cervix, and therefore resulting to cancer. In this particular case, what we say, what happens in cancer is that the normal mechanism of the body, God created the body in a way that cells die, others are formed. Yeah. Cells die, others are formed. So there is an equilibrium. There is a start and stop mechanism. So once that start and stop mechanism is faulty or goes haywire, then it means the cells just grow. In medicine, you say proliferate without any limitation, and that is what causes cancer.
And now, what are now the symptoms, or what are some of the things that somebody may actually look out for?
Actually, the first symptoms of cancer, one thing you have to realize is cancer of the cervix, before you get full-blown cancer of the cervix, it takes about 10 to 15 years before symptoms start in cancer of the cervix. So what we're saying is that in the first formative years, cancer of the cervix, basically once it starts, it's symptomless. There are no symptoms. But the earliest symptoms you get in cancer of the cervix, in early cancer of the cervix, is bleeding per vagina. That is the earliest symptom in cancer of the cervix. This can be spontaneous bleeding, that is unprovoked bleeding, or it can be bleeding during intimacy or intercourse. Yeah. Yes, those are the earliest symptoms. Symptoms in advanced cancer now will vary. It can go to pelvic pain around the pelvis, being very common. In very advanced, where the cancer has spread to other regions of the body, the symptoms, you can see if it spreads to the colon, you can get constipation, you can get bleeding through the rectum when you're passing stool. If it goes to the lungs, spread to the lungs, then you will get, of course, you'll get symptoms in the lung, maybe breathlessness or coughing blood-stained sputum. Yes, and those are signs of advanced
and
cancer
what
of the
about
cervix.
the odor coming out of the vagina? Do we have that as also one of the symptoms?
Yes, that is another symptom, because once this bleeding, when there is bleeding, not all blood will come out. So some blood is left there clotted. And this also gets invaded by microorganism and produces a foul-smelling odor. It is also a symptom.
And also, so that also brings in the question that after seeing these symptoms, is it that time that we should see a doctor, or what point can we see a doctor? What time can we have an appointment with a doctor?
I would say a very good question. I would say that even that time to see a doctor is late. You should have seen a doctor earlier, and that is why I advocate for screening. So the doctor should not be seen once the symptoms set in. But of course, if the symptoms are there, then you should see the doctor. But you should immediately, you get these symptoms, like you have any bleeding through the vagina, then you should see the doctor immediately to rule out any chances of cancer of the cervix, because there are so many other cases of causes of bleeding per vagina. But it is good to rule out than ignoring, and then you can end up discovering that it is cancer of the cervix.
And of course, now moving forward, extrapolating this to another thing, the risk factors. There are some things, or there are some people saying out there that having many sexual partners is a risk factor of getting cervical cancer. First of all, question to you, is this a myth or a fact? And as you answer that, then maybe also you can tell us about other risk factors, if that is one of them.
This is a fact, because as we said earlier, is that cancer of the cervix is associated with the human papilloma virus that is sexually transmitted. Then it goes without saying that the more sexual partners you have, the more chances of contracting the human papilloma virus. Then the other thing, what happens is that it's a risk factor. Then also poverty, I would say. I would call it a risk factor, because you find that this disease is common in the developing world. You ask yourself why.
Yeah. And that is something we'll talk about after the break. But of course, there are also some other risk factors like STIs, and also something like having early sexual activity. Could you please tell us about that, and what can we do as a nation?
Yes, early sexual activity is also a risk factor, because when this girl is exposed to early sexual activity, it means then you have a longer period of chances of being exposed to the human papilloma virus.
Yes, of course. Yeah.
Yes, and of course you get that, you find that this early sexual activity, some of it is associated with people looking for money. So these girls looking for money, so they will get many sexual partners. And thereafter, then you're likely to get the human papilloma virus.
Smoking is also associated as a risk factor.
It is a risk
because
factor.
of its relation to the squamous cell, yeah. And also, we also are smoking and also weak immune systems. Could you please tell us about that also?
Yes, smoking is a risk factor because there are some carcinogens that are found in tobacco that are known to cause distortion of the cells of the cervix. So it's a risk factor also. And then there is also, what did you mention about?
Weak immune system.
The weak immune system. As I said, how cancer comes about, all forms of cancer, is the autoregulation of the body that breaks down. So when you have reduced immunity, this autoregulation is compromised. Therefore, chances of cancer, any form of cancer, increases with reduced immunity, be it due to most likely due to an immunodeficiency illness like HIV. Yes, it affects the autoregulation.
Thank you very much, Dr. We're now going to take a very short commercial break, and we've been talking about cervical cancer. We've talked about the risk factors, we've talked about the symptoms, but when we come back, we will be with Dr. Macharia, and he'll be telling us more about how to maintain, or rather how to treat these things. See you on the other side of the break.